And again, thank you for spending this time with me today because today's topic is one of the biggest blind spots in modern clinics, and that's patient relationships have somehow become harder to maintain, not because you care less, but because the system around you hasn't kept up. In a hybrid world, in person or hybrid meaning in person plus telehealth, clinics need new ways to stay connected, compliant, and responsive. And that's the promise today. We're going to give you a clear roadmap for how to do that exactly, because what you can expect for today is the real costs. We'll talk about the real cost of disconnection in hybrid care. We'll let you see the green zone, what a connected, compliant hybrid practice looks like, the invisible admin gaps every clinic is struggling with, how to transform your patient relationships without burning your team. And of course, we'll talk about real case studies because the things that are happening right now is real, but there's also real victories that we see every now and then, and how we can help you bring this into your clinic starting today. Now, of course, let me just formally introduce myself. My name is May, and I am the head of training for GP Hero. And why this matters to me is because for the past few years, I've worked with hundreds of Australian GP clinics, and I've worked with practice managers and their teams closely, helping them stabilize their admin systems and growth without overwhelming the team. And a lot of my work happens behind the curtains. I'm supporting practice managers and owners who are fighting fires all day, whether that's results, referrals, or recall backlogs. There are delayed recalls, missed privacy checks. You know the drill. So when I talk about simplifying work, protecting data, and leading with confidence, it's because we saw what actually works across clinics that we support with. And of course, before we talk about solutions, we need to talk about the problems, the real ones that are showing in telehealth down today. Now, let's be honest, telehealth is not new, right? It's permanent, it's here, but most clinics are still running like it's 2020. Most clinics are still reactive. Most clinics are still doing it manually, patched together with sticky notes and good intentions. And demand for remote consults has skyrocketed after the pandemic, but the systems behind them didn't keep up. And we see a lot of incredible doctors and hardworking admin teams losing hours every week because the workflow behind telehealth consultation isn't built for scale or audit readiness. Now, if you can picture with me, if somebody walks in your clinic right now and followed a telehealth consult from start to finish, would they see a one clean process or would they see five different versions depending on who's on shift? Ponder on that thought for a moment. And I just want to let you know this is an honest space, no judgment. That's why we're here. And if you've been to some of my webinars, I always say when you can name the problem, then you are already solving 70% of the problem. That's what we're doing right now. We're naming the problem. So let's pop the hood and look at what's actually breaking the telehealth workflows, because there's a hidden cost to it. And the painful part to that is when there's loose telehealth workflows, you're not just actually wasting your time. They cost trust, they cost revenue, and they cost people. Because every missed follow up, every unbilled telehealth consult, every recall that slips, that's not just admin, that's delayed care. And more importantly, that's money walking out of your door. Now, if your clinic feels like it's slammed, but not necessarily more profitable, you got to step back and ask yourself, what's the reason? Like there's something hidden behind it. Because with the clinics that I've worked with, most likely the culprit is definitely this. It's not a people problem, it's a system issue. Because when you see the things are getting so busy, but there is no profit that is coming in, you either think that you have to sacrifice one of the other, whether to conform to what's happening right now, stick with the current number of your people, and then hope that tomorrow gets better, or spend more money on people and then hope that tomorrow brings more profit because you've hired one more person in your team. I'm going to say it again. The culprit behind why you feel slammed and you don't see any skyrocketing profit is definitely because you do not have a people problem. You have a system problem. So the question then is, how do we stop the leaks? How do we shift from constant firefighting to workflows that simply work? Because that's where structure comes in. Most clinics, and I find this with everyday conversations that I have with practice managers, they don't need more staff. You need a framework that lets the people do, or lets the people that you have perform at their best because they're given the capacity to do so. Now, before we go deeper into that, let's unpack three areas where clinics either run smoothly or fall apart. And you will work on me with this one. So, we're going to do a traffic light. And when I say traffic light, we're just going to do a color coded system. And I want you to either think of it, picture the color in your mind, write it down, or note it in a note taker anywhere. Because again, when we're able to name the problem, when we're being honest about the problem, we're already solving 70% of the problem. So only three colors. You have red, orange, and green. So when we say red, it's chaotic, it's out of line, you don't see any improvement, it's out of the window, and there's no hope really for you. When we say yellow, sometimes there's improvement, sometimes there is, depending on who's on shift or depending on the days. It's not Monday, so it's not busy, so it's okay. But when it's Monday, it's so busy, so it's chaotic. So you don't see that consistency when it's orange. And then when it's green, it means that it's smooth all throughout, no matter who's on shift or no matter what type of or what day is it. So we're just going to talk about three key things right here. First, let's talk about patient communication and engagement. Now, think of your recalls, think of your reminders, think of your follow-up instructions, your telehealth directions. When it comes to patient communication and engagement, are you red, where there's no system, so everything is out of the window? Or are you orange, wherein sometimes it's good, sometimes it's not good, and you don't see that consistency all throughout? Or are you green, 100% on all the time? Because you have to understand that when patient communication and engagement cracks, you have a lot of no-shows, you have frustrated patients, and phones are ringing off the hook. But when it's right, when it's green, patients know what to do without your team chasing them all day. So I'm just going to give you 1 minute to think about that. What's your primary color when it comes to patient communication and engagement? Red, orange, or green? All right. Now let's go to the second issue here, admin workload and task management. Because if it's not calls that's draining your team, it's definitely this. This is the other side of that coin. And this is where most of the burnout actually lives. Those phones, results, scripts, billing, and recalls are all happening at once. And the more manual it is, the faster the pressure rises. Because what I see every day is 60% of the day is spent on repeat admin, when in fact you can actually have a system behind it, whether that's a trained VA or AI, that could easily handle that. So ask yourself, in terms of admin workflow and task management, what's your color? Are you red, wherein nothing ever gets done right? Are you orange wherein sometimes it's there, sometimes it's not there, you don't see the consistency? Or are you green wherein you got it handled 100%? Right. And then let's talk about your billing and MBS compliance, because there is this intersection of money and risk, is it? That's always the case all the time. Because when you miss a step or when there's a wrong MBS item that is selected, you forget a telehealth requirement, you actually risk revenue loss and compliance issues. Because when that happens, there's actually a hidden drain both in money and risk. So, in terms of billing and MBS compliance, what's your color? Are you red, orange, or green? Just 1 minute for you to like reflect and really be honest about where you are in terms of billing and MBS compliance. All right, so that's our traffic light checking right here. Now, think of those three things that we have talked about, and whether that's in your mind or you've written it, ask yourself, what's your primary color right now? Are you mostly red? Are you mostly orange? Or are you mostly green? Because I'll tell you, as early as now, if you're seeing red or orange here, that's not failure. But this is a light bulb moment for you. This is clarity. And clarity is your starting line. And if that is someone, or you're someone now that is sitting in red or orange, then what you can do as early as now is book a clarity call with us. Because then in that clarity call, we can specifically talk about what it is or what do those red or orange represent. So to book a clarity call, our team at GP Hero is just gonna drop that link. You can just go into the link right now and have that one-on-one conversation with me. Spend at least 30 minutes more to like, talk about what is happening in your clinic so you can see where the drain is going. It's no pressure. It's not even a sales call. It's just a walkthrough of where your workflow is strong and where it's costing you. So, moving on, when we say what every clinic truly wants, and this is a result of conversations that I've had with hundreds of Australian GP clinic owners and practice managers, what every clinic wants is definitely a calm clinic, right? But when we say calm clinic, it means not more tools, not more stress, but just calm. However, there's a misconception wherein you think that calm is equivalent to quiet. And sometimes in business, quiet means no profit at all. And the directive always of business owners is to embrace the chaos. And I've learned this in a book by Dan Martell, Buy Back Your Time. It says there, you can be so downright addicted to chaos that you're not anymore comfortable with calm. You feel uneasy when there's calm because to you, calm is equivalent to quiet. But let me tell you right now, a calm clinic is not a quiet clinic. A calm clinic is a controlled clinic, meaning calls feel manageable, inbox is under control, billing is clean, and patient comms are predictable. And you see your team, everybody in your team knows what they're doing, and more importantly, why they're doing it. Because if you can think of your clinic right now on its best day, I'm sure there's a lot of best days in your clinic where everything just flows. You got to ask yourself, was it pure luck or just because that day you actually had a grasp of structure, right? Because when we say calm clinic, I'll tell you, most clinics would actually result to more warm bodies. We just need one more hire. We just need one more tool. We just need one more capacity to like really achieve the calm clinic. But more warm bodies, more tools, more systems that you don't understand is actually just the tip of the iceberg. But to attain that future-proof business, that calm clinic, you actually need to go deeper into the iceberg. Because what creates a calm, scalable, future-proof clinic is underneath. And that's what we call confident compliance, meaning audit-ready systems that keep you safe, integrated operations, workflows that connect everyone, and intelligent support systems, meaning tech and tools that lighten the load. Because if these aren't strong, adding more staff, adding more tools, adding more subscription to AI, it doesn't make you calm. It just adds more noise in your clinic. Now, when you look at this right now, you gotta ask yourself, what are you building? What are you strengthening? Are you strengthening the tip of the iceberg, which is just more warm bodies, or are you strengthening the foundation? Because when you have that moment of, I call it the light bulb moment, when you have that and you get the answer to that question, you got to also understand even the best plans collapse without consistent support. And that's where most clinic get stuck. It's not in strategy because you've tried, you've outsourced, you've checked all the solutions. It's not that, but it's execution. Because at the end of the day, you as the practice manager, you as the clinic owner, you're still behind from the things that you had to do 3 months back. And now a new strategy is presenting itself, but you find that you don't have the time to properly execute it. And that's where we come in. At GP Hero, this is the exact moment where we come in. We're not just a staffing agency, we're your remote clinic admin team trained specifically for Australian GP workflows. And our team plugs right into your systems, whether that's best practice, hot dog cubicle, or Automed, and all of those other tools. What we do is when we plug into your system, we bring consistency and calm into your day, right? Because when we talk about each of those individual pillars, let's talk about the first pillar, which is confident compliance. Now, every clinic wants to feel this. You want to feel like um, everything in the clinic is audit ready, but then only a few clinic feels that 100% and translates into actuality. Between a lot of things that has happened this year for Australian healthcare, there were MBS changes, there were privacy reforms, there are new telehealth rules, mental health rules has changed as well. Compliance keeps getting heavier. And at GP Hero, compliance is baked into our workflow. It's not bolted on. It means that our VAs are trained in RACGP privacy standards, Medicare billing standards, and data security protocols before they ever touch a real clinic. But a bit of an introduction about GP Hero. Who we are, our mission is very simple: to empower Australian general practice by providing dedicated offshore administrative support. And our deep expertise is in GP admin, billing, and compliance, exactly the things that are weighing your team down. We onboard 15 new clinics every month, and our main marketing tool is definitely word of mouth. That's how you know that we're doing things correctly because our marketing, our feedback, glowing feedback from our partner clinics. We now have about 99 clinics that is in partnered with us, and we're continually growing because with us, you don't have to start from scratch. You don't have to execute from scratch or from scratch rather. You're starting with someone who already understands your world. Because for GP Hero, security is not optional. It's the foundation of everything that we have built on. Because what you want to be assured of is how do we handle data privacy? And how we do that here is we have our own data privacy and compliance training, meaning every one of our heroes goes through a rigorous privacy and compliance training. There's secure communicating or communication protocols, there's role-based access, and we carry our own professional indemnity insurance. You're not guessing, you're protected. When we say no data ever leaves your server or is transferred offshore, we do not allow work from home setup. No one is a freelancer in our office. All of them goes into all of our VAs goes into a secured office that's protected by 24/7 CCTV and security personnel. And they have their own device, which is protected by multi-factor authenticator. No one else can get in outside of the VA that owns the device. Yeah, so that's what I've talked about there. We also conduct our own regular cybersecurity audits so that we can maintain high safety standards. We have our own internal IT that helps us with that. And like I said, we carry our own professional liability and our own cybersecurity insurance. It's on top of the physical feature that we have put in place to ensure that the work that we do for you rather is fully protected. Our professional liability insurance or professional indemnity insurance and our cybersecurity insurance is in place from day one, meaning the moment that you select a VA, that is already activated for you because we want to be fully compliant with the Australian privacy laws. Now, in terms of our employee screening, all of our VAs, before they ever touch your patient data, they go through a thorough background checks. We check on their education, we check on their previous employment along with criminal records, and of course, we check on who referred them. Because to us, it's important that we're covering all bases before we ever let them touch your clinic data. And then they undergo to a data privacy training. We have our own mandatory HIPAA certification that they have to take every year and on start of their training. And of course, the Australian privacy law certification. Skill verification as well, because that's very important. So we have a set of assessments baked in our training program, assessment of technical and proficiency in terms of the required tools, whether that's any practice management software like Best Practice or Best Practice Medical Director or the newer PMS that is in the market right now, and third-party tools like Cubico, HotDoc, AutoMed. So all of our VAs goes through a skill verification. And then there's ongoing monitoring because we have our own team of quality analysts. We also have our own team of trainers and team leaders that's going to help you drive that productivity so you're getting results without having to do the heavy lifting for your VA. And then we have our state-of-the-art facilities. Like I said, no work from home setup. All of our heroes comes into a physical office. It's a monitored facility and it's built for healthcare level compliance. And that is pillar number one right there, confidence through compliance. Now let's talk about integrated operations. And this is that second pillar and the second layer of the iceberg. What do we mean by integrated operations? What most clinics want is one unified workflow for in-person plus telehealth for every hybrid checkup. And you would need clear, predictable follow-ups. There's consistent GP to admin handovers, zero lost tasks or mixed up processes, and a patient journey that feels so seamless. And when you look at your system, you have a system that reduces noise instead of adding to it. And hybrid care that doesn't rely on who's on shift, it doesn't rely on memory games. And clinics just definitely want everything to flow in one direction, not five different versions of the same process. Because what usually happens when there's chaos, one person can be doing recall differently and another person can be doing it differently. And your version of done is never achieved because people do things so differently in your clinic. Now, the GP Hero promise is integration, not imitation. What it means is integrated hybrid workflows. We are not copy pasting your admin, we're not duplicating it. We have VAs that are trained in the exact systems that you use. There's standardized handovers that captures every task, unified follow-up loops for telehealth plus in-person visits. There's real-time task tracking and oversight by your VA, by our own team of QAs, and by our team of team leaders. And there's constant or consistent execution across every shift. And a remote admin that plugs directly into your operations. Because at GP Hero, we don't imitate what your team does. We integrate into how your clinic can operate. And what it means is when you delegate a task to GP Hero, you're not delegating and having to like twist your hand and hope that it works. It's never the case for us. We're specifically trained. We understand the workflow and we understand the why behind every workflow. Now, of course, all this is great, but then you're asking, what are some of the tasks that we can take? Because I've already mentioned a couple of them, but is it just that task that we can take? Then the answer to that is we have our ultimate task checklist. It consists a list of everything that we can do for your clinic. Because if I walk through all of the tasks that we can do in this webinar, we're gonna need more time because we cover a lot of things. But if I can sum it up, it's this: whatever thing that can be delegated virtually, you can delegate that to us. The only thing that limits us from helping you are things that has to be done physically. And when we say things that has to be done physically, that's a high value task for your onshore team. That patient facing task, like you got to ask yourself, how long does it take for someone to greet patients that are coming on your front door? How long does it take for them before they are entertained or before they are catered to, right? And that's a high value task for your team. Now, of course, when we talk about team, you are the main driver here. You are the operator. Uh, you are the destiny setter. You are the director of this. So we also have to offload um, tasks that is in your task list right now. And I always do this exercise so that you would find that there are actually tasks that you're doing that you actually also can delegate onto someone else. Just tracking back a little bit, sorry, that ultimate task checklist, a link of that is going to be sent into our group chat or the chat box right now if our team of GP Hero hasn't done it yet, but it's already there. You can just go ahead and click on the link and download, and you will see the list of tasks that we can cover for you. But right, going back to this, what about you as the practice manager? Do we leave you busy, but your team can now breathe? Of course not. We'll ensure that you also get your time back. And this is always an exercise that I do with practice managers who are in neck deep when in terms of tasks that they're doing. And I call it the delegation exercise. So in the delegation exercise, if you can just bear with me, you have 4 boxes right here. And very simply, what you're going to do is you're going to list tasks based on where they categorized. We do not have the time to do this on this webinar right now, but perhaps what you can do is do it later after this webinar, and you will find yourself in shock that you're actually doing a lot, but actually it's something that you can delegate to someone else. Right. So the first basket is don't know how to do and don't want to learn. Now, you find that there are tasks that is so important to keep the clinic going, like website management, social media, your digital presence. Even some clinics right now are adopting CRMs like Go High Level just to boost the medical or the digital footprint that they have. Now, at times with tools like this and with tasks like this, it's scary because you think you have to learn them by yourself, but you actually don't want to learn because the truth is you don't have the time. So if that's a task that you're thinking right now, even if you're still thinking about it, that's still a task. And you go ahead and write that here in the first basket, which is don't know how to do and you don't want to learn. And then the second basket is don't want to do and you don't enjoy doing. I've spoken with a lot of medical, people in the medical field, doctors, clinic owners, practice managers, nurses, receptionists. And I've only heard two people that told me they enjoyed doing chasing debtors. And if that's you, if that's a task that you're doing right now and you don't enjoy doing it, then go ahead and list it here. And what are some of the other tasks that you don't want to do and you don't enjoy doing? And then of course you have don't have time to do. So this is the ones that's still on your to-do list from 3 weeks ago. Just go ahead and do that. And then the most important basket for you to identify is this last basket here. Tasks only you can do, literally requiring your face and your voice. Now, I'm going to give you a bummer right now. When you're a practice manager or you're a clinic owner, this task should only be 5 tasks. Only 5. And you're going to take a deep breath and you're going to tell me, I'm not doing 5 tasks, I'm doing 1 million tasks. Well, then maybe what you want to do is list all of the tasks that you're doing under this. And then ask yourself, is it something that someone else can do? Is it something that I can delegate? Or is it true that only I can do it? Because a lot of times, tasks that you're doing right now is actually something that is on your to-do list, but you actually can delegate, or it's something that you don't enjoy doing. Because that's your light bulb moment right there. That's how you free up your time. That's how you free up your capacity. Because instead of working in the business, busy covering for shifts, busy patching up, it's time for you to work on the business, strategizing, scaling up, onboarding more doctors. What does 2026, what does 2027 look like for you? That can only happen when we're able to free up your capacity. Right, so that's the second pillar right there, integrated operations. Then let's move on to the last pillar in that iceberg, which is intelligence support systems. Now, when we say intelligence support systems, most clinic wants a support that lifts the workload, not adds to it. A lot of the clinics have mid-year this year have adopted AI, but then in the last month of the quarter has given up because they find that they were waiting for a support, but it was too complicated to like even think about it, right? Now, when we're talking about intelligent support system, what clinics want is admin capacity that actually reduces pressure, a team that can keep up with the hybrid care demands, faster follow-ups, there's cleaner documentation, fewer bottlenecks, hands that are trained, proactive, and reliable, and support that frees GPs and nurses to focus on care, meaning less firefighting, more predictability, and operational calm, not constant catch up mode. Because when you are in that situation where you've tried more people, you've tried to subscribe to a CRM or an AI, you're finding that you don't actually want more bodies just for the sake of it. You want better support. And that's where GP Hero comes in. So when we say VAs who speak clinic, we mean intelligent support system that make your clinic run smoother, meaning dedicated healthcare VAs trained specifically for GP workflows. There's managerial oversight plus QA. You're never left alone to manage them. There's continuous training programs aligned with MBS privacy and admin best practice, task tracking, performance monitoring, and workflow supervision. And there's rapid execution of follow-ups, referrals, recalls, inbox, tasks, whatever that is, because you have a remote team that handles admin load consistently every day. And what that results is an operational breathing room for your clinic that has been missing there. This isn't about extra admin, it's intelligent support that transforms how your clinic works with intelligent support systems by putting VAs who speak clinic. Now, we've talked about this already, but just so you know your support team, when you partner with GP Hero, you get a dedicated virtual assistant. You have managerial oversight with our account managers and our support team, QAs, our trainers in place, and there's continuous support. Um, I touched about this early on, AI and healthcare, and like I said, a lot of the clinics have adapted AI, but soon had to let it go. And it's not because the AI was not being effective. We saw this with a lot of clinics that we've worked with. It's not because the AI was complicated, but it's because, number one, there's no clear regulation of AI usage in Australia right now, and clinics are kind of frightful as to how the AI can erratically behave that the fallback can fall on them. I'll tell you this, what's missing for those clinics that gave up using AI is the human oversight. There are things that AI can't replicate. And when you're using AI, you definitely need the humanness, that human tone to ensure that the AI is behaving properly. But at times, clinics give up not because the AI was too complicated, but because they didn't understand how it worked. They didn't understand how to properly use, how to properly execute it. At GP Hero, we've already adapted AI 100% into our workflow, and the success rate that we see is so different from those that have not adapted AI. Just so I could give you an example, any one of our heroes that does inbound phone call right now has a specific AI that works with them to ensure that the clinic SOP is being aligned. They know which doctors accepts which type of patients, not having to like go back and forth with the head of the receptionist. And all the files scanning and allocation is also AI implemented, making the work faster. When before AI came into place, when somebody wants or a clinic wants a receptionist, it would take us 1 month, 1 to 2 months before somebody can like pick up the phone call, because when you're an inbound call taker, you have to learn everything. Now, with AI coming into place, we have dwindled that training time to 2 weeks, meaning within 2 weeks, you already have an inbound person taking phone calls for you. And that's the beauty of AI. When you know how to manage it, when you combine technology and the quality side of humans or of people, you actually can get a lot of things done faster, and you actually can get a lot of results that way, right? So going back to our training and development, like I said, we have ensured that before a hero touches your clinic data, they are already plug and play, meaning we have our own comprehensive training programs. I'll show you how I built that from day one. We have our own skill enhancement. Every quarter, we check on where the hero is standing or what's the quarterly score. We do early warning signs for those that are underperforming so that you don't have to catch it yourself, because we've already implemented some action plans. And then there's continuous development. And this is our employee training program. Take note, this is done before they touch a clinic data, before they are introduced to clinics. So it starts with general knowledge of Australian general practice, including introduction to the country and time zones, which is very important for us. Then there's training on Medicare, eligibility, the benefits, what is covered inside GP clinic, and understanding how billing works for Medicare. Then software training for general practice. So whatever software that is, whether that's practice management softwares, third-party softwares, and AI as well. We've integrated and incorporated that into our training program. Then learning administrative tasks. When we say learning, we're not just telling them what's the meaning of a terminology. What does it mean when you have to do recall? What does it mean when you have to allocate a document? But we're making them see why it's so important to carry out steps accurately. Because when steps are not carried out accurately, it's a ripple effect, and the end result of that is always a delay in patient care, right? So yeah, learning administrative tasks, then they're trained, and then there's development and evaluations, and it's a whole cycle because we always like to ensure that our heroes are performing and that the knowledge that they have is still up to date. So some of the roles that we can fill, we have our own, we have people that can do admin support for you. So whether that's administrative tasks in terms of allocating your documents, email inboxes, or performing bulk health identifier. We also have people that can manage your appointment books, and of course, people that can do receptionist. Just this year, we've adapted executive assisting for some doctors. We also have people that are web designers and web developers and social media managers for clinics. And if you're wondering, which role could suit you? I'll tell you this. Book that clarity call with me. Let's talk about this because the first thing that we have to do is identify what's missing in your clinic. And that can only be answered when we have that one-on-one session. Our team at GP Hero is again gonna drop that link so you can just click on the link and book that clarity call. Take a few seconds and book that call right now. Right. So just a few examples of what we have been doing in the space and how some of the clinics has changed the situation that they were in. We had this one clinic and they have about 25 GP. They are a metropolitan practice, so you can understand that there's high telehealth volume and there's admin overwhelm. And the problem initially when they went on a clarity call with me is that telehealth follow-ups were inconsistent. Sometimes GPs are actually sending tasks in multiple channels, so things got lost. It was chaotic. There were 600 plus pending in their emails, and then missed recalls that are affecting continuity of care, and patients that are complaining about unclear telehealth instructions. What they did is that they integrated a GP Hero VA into their workflow, and then with them together, we built standardized handovers, standardized SOPs, standardized templates, and we created one unified hybrid workflow for in-person or telehealth consultations. And um, what I like about it is because the last time that we've talked with this practice manager, I think they just turned 1 year with us, is that they said it is now calmer compared to how they started before because a lot of the repetitive tasks that was weighing their team down, that was blocking them from fixing the things that needs to be fixed is now worked on by their GP Hero VA. Matter of fact, recently they just added one more VA into their workflow as well. Right. So what about you? What's like landing for you right now? Because what I just talked about right there, we've talked about the problems, we've talked about too much admin, we've talked about too many gaps, we've talked about too many versions of workflows, and there were even reflective moments wherein patients were slipping between the cracks for you. And what's one thing that's landing for you? Because you saw how this is effective. You saw that what we can offer on the table, because what we can offer right now is the things that happened for that clinic, we can make it happen for your clinic also. So what's one step that you want to take right now? What's one step that you want to take for from transitioning from red to orange into green. Because I'll tell you this, that red will still stay red if you don't do anything. That orange can quickly escalate into red if you don't do anything. So just reflect on that for a minute and ask yourself, do you want a calmer clinic? Do you want a calmer workflow? Do you want a clear follow-ups? Do you want a connected patient care? Because if you do, it actually starts with clarity. And this is exactly why we offer the clarity call. Again, it's not a sales call, it's an operational audit. And it's just 20 to 30 minutes. We'll walk through your hybrid workflow, your biggest admin risk, your telehealth gaps, and what's costing you time, money, and patient trust. And we will talk about your roadmap, how you can move from red to green or how you can move from orange to green, even if we don't work together. Because that's the main thing. In the clarity call, we'll see if GP Hero is the right fit to help you fix that operational gap that you have. Either way, when you book a clarity call, you will walk away clearer than when you arrive. That's my promise. You can scan the code that is in your screens right now, or you can actually also just click on the link that our team at GP Hero has been posting. And like I said, when you book that call, what you're getting is a workflow audit tailored to your clinic, identification of your hidden bottlenecks, and a personalized hybrid patient journey map. And if GP Hero is the right fit, great. We'll show you how we can help. If not, then you still walk away with a plan. You win either way. Now, if you are sure that you need a VA, but you just also want some specifics, like you want to know how much it costs, you want to know what are the tasks that we can do for you, you want to know who carries our insurance, you can just scan the code right now. It should take you to our GP Hero Essentials that carries all of the information that is that talks about us. Right. So, do we have any questions from the group right now? Oh, do you mean the clarity call code? We'll ensure that you will get it, Akil, on uh via email as well. We'll ensure that our marketing team is gonna reach out to you. But the link also is still live. It still takes you to that same clarity call. Can you support telehealth only clinics? We support general practice. So whether you're working purely telehealth or you're doing hybrid or you're not doing telehealth, we support GPs at every GP clinic. Do you have any solo practitioner clinics on board? We do. We actually do. And if you want more clarity on that, Akil, just book a clarity call with me. We can talk about it on that clarity call. No problem. Any more questions from the team? Can you train your software staff with any other software? Do you mean practice management software? Yes, we have clinics that uses Halaxy and Helix, and we have built our own training plan around them. So yes, we can train staff with other software. Last call for questions. What about staff onboarding? To be honest, that's a bigger conversation. It will take me good 5 minutes to explain that to you. Here's what I can do. Just go ahead and you can book a call with me in that clarity call link, or our team at the marketing team rather is just gonna reach out to check what's your available time, and when we can like have that conversation, or we can even just send you also like a document that explains the staff onboarding if you don't have time to meet. But I would really recommend for you to meet with me, because then that's gonna like we can like have a free fall with questions, right? How does this work for rural clinics? Do you have like a specific area that you would want me to talk about, or is this just in general sense? Because if it's in general sense, it's actually also a lot to like talk about in this webinar. So I would really encourage you to just go ahead and book the clarity call, or I'll have our marketing team reach out to you for like specifications about that question, because that's a huge topic that you're touching on right now. But if your question is, do we have rural clinics that isn't partnered with us? Yes, we have. We have a mix of metropolitan and rural clinics that isn't partnered with GP Hero. All right. So, oh, we have one more. Do you work with all practice management software? I don't want to say all because that's misrepresentation, but there's variations of um of practice management software that we work with. Yes, best practice medical director we have. Where patients have limited understanding of technology. It depends on what tasks you are delegating to your VA. So um for those that are doing inbound phone calls, then of course the pacing and some of the clinic specifics is really explained properly into the VA so that they can adapt quickly. And again, if you need more clarity on that, I would really consider like, booking a call with me so we can talk about it in more clarity, just so I can also answer and hit the right spot that you are aiming for. Right. So that's all the time that we have. Any other questions that would follow is also just going to be collected by our marketing team. And we will go ahead and get in touch with all of you. If you have any more questions, if you have any more things that you would like clarity of, our clarity call link is still live. And you can also visit our website, www.gphero.com.au, to learn more. Now, you've already invested so much time, and I just really want to thank you because I know clinic life doesn't actually hand off breaks here and there. So the fact that you are here means that you're taking the first right step. It's scary. The first step is always scary, but then you're taking the right step to ensure that you have the capacity to grow, you have the capacity to break out of whatever it is that's bugging your growth down. And remember, if I can leave you with something, it's this. When you are secured, or when you want to reach that calmness, it doesn't start with quietness. It's never that equivalent. It starts with control. And who better to define that level of control than you as the clinic owner or you as the practice manager? So that's all the time that I have today. Thank you so much for joining me. And we always have these webinars every month. Feel free to join us, or I'll see you on that clarity call. Thanks, everybody.